Today is National Skin Cancer Awareness Month, and since summer's quickly approaching, though it doesn't quite feel like it right now outside, this is a good time to talk about the dangers of the sun.
Yeah, skin cancer, in fact, is the most common form of cancer in the U.S. 20% of Americans will get it at some point in their life. So joining us around the table to talk about it is Dr. Sabrina Fabi. Thanks for being here.
Thank you.
All right, you're a cosmetic dermatologist, so you see a lot of people coming in talking about sunspots, aging from sun. You're also looking for the cancerous one. So kind of try to explain to me the difference between like a normal sunspot versus what we're really looking for with skin cancer here.
To the naked eye, for most people, they probably sometimes can't tell the difference. And that's the reason why they rely on coming into a dermatologist to help determine what is the difference. But a scaly spot that is red and it's not healing, that's usually a sign of perhaps something called a squamous cell carcinoma. That's the second most common form of cancer. You can also have one that's kind of pearly and red and has little blood vessels in it. It looks almost skin colored, but maybe a little bit of shine to it. That is the most common form of skin cancer, and that's a basal cell cancer. And like you said, 20% of Americans in one point of their life are going to have a skin cancer, and it's usually going to be the most common form, which is a basal cell. But the one that we're always really scared about is something called a round spot that, yes, could perhaps look like a freckle that's gone a little bit awry. And there you're concerned because that is proved to be deadly. And it is actually the most common form of cancer in those in the age groups of 25 to 29.
Really?
And the second most common form of cancer in those between the ages of 15 to 25. And so this is a form of cancer that we're actually quite scared of. And there are some common things that you can look for to make sure that it is not like a common freckle.
It's pretty amazing how many people are affected. You talk about some of these numbers of millions of people who are affected. Who's greatest at risk?
Yeah.
Is it a certain people with lighter skin, for example, or the color of their hair, or I read some parts about taller people.
I know.
Is that right? Is that right?
They're closer to the sun.
They're closer to the sun.
I read your notes. I saw taller people.
There was one study where they found that taller people may have a higher incidence, but it's really people that usually have lighter fair complexion, lighter eyes, lighter hair. But that's not to say, and this is the misconception, that darker skin types, African American, Hispanic, those folks can also get skin cancer. And because they've always been a more olive tone and they can tan quicker and not necessarily burn, which is another risk factor, they don't go in when there is something that's growing. And their lesions tend to be even on the palms of the hand, soles of the feet. And so they usually present when it's gone too far and it's actually at a more aggressive stage of the condition. So I would not say that you're exempt if you have darker skin, but yes, if you have a history of a lot of sunburns, then you are definitely at greater risk.
All right, so it's the most common form of cancer. This also, to me, and maybe this is ignorant of me to say this, but it feels like it could also be the cancer that's the most easiest to prevent. We're talking about like wearing sunscreen, right? That's got to be the easiest thing you could do.
Yes, so sunscreen. Well, first of all, no tanning beds. The scariest statistic that I read was that those that have had some level of sunbed exposure before the age of 35, 59% increased incidence of developing skin cancer, specifically melanoma. So that is number one, preventable. Two, yes, using some type of mineral-based sunblock. So something that has zinc oxide as the primary ingredient, titanium dioxide perhaps as a secondary one. And the key with that is yes, an SPF of 30 or higher is good. People get so focused on the SPF, is it 100, I'm okay. What's really more concerning and what's more appropriate is how often do you reapply? You lose that SPF, whether it's 30 or 50, in as early as 80 minutes. So we generally recommend to reapply in an ideal world every hour, but at least not go every 2 hours, especially in San Diego, because the misconception also is that if you're in the shade, you're fine. If you're wearing a hat, you're fine. Or if it's cloudy, you're fine. But 50% of your UVA is in the shade, including when you're driving. So you need to be reapplying that sunblock to prevent that other UVA from penetrating and damaging your skin.
Always good points, especially as we get really into the summer months. Dr. Fabi, thanks for being here. I always appreciate it.
Thanks for having me, guys.